Get ready with me as I tell you what I just heard about Tirzepatide / Mounjaro approval for weight loss and what you can do to try to get coverage. I'm an obesity medicine doctor and I'm founder of SoWell, which provides at-home diagnostic testing and metabolic health supplements, and SoWell medical management groups. And this is my whole life, so when I get some inside scoop, I want to share it with you. I just heard that Eli Lilly presented SURMOUNT-2 trial data to the FDA, which means we are 2 steps away from possibly getting coverage of Tirzepatide for weight loss, and maybe we'll get it by the end of the year. Now, this is so exciting because Tirzepatide is very effective at weight loss. SURMOUNT-1 showed that people with a BMI greater than 27 without diabetes had up to 22.5% on average weight loss by 72 weeks. That's amazing. So this will become the most effective tool in our toolkit to treat the disease of obesity. But the big problem is that many Americans do not have insurance coverage of these anti-obesity medications. So what can you do about it to try to give yourself a leg up? First up, you're going to call your insurance company and you're simply going to ask what medications are on formulary and what's required to get coverage of them. If you unfortunately find out that they do not cover anti-obesity medications, you are going to talk to your HR department and you're going to advocate for the appropriate coverage of medications that are approved to treat the disease of obesity and, advocate on your behalf and for all of your colleagues. You'd be surprised, this works. I've had patients who've had really big success in this. Sometimes your doctor will write a letter of support like I will. Okay, but what about if you have marketplace plans, government insurance, Medicare, Medicaid? This is what I want you to do. And honestly, I want you to do it even if you already have coverage of these drugs. I want you to call your state representatives and your senators, and I want you to ask them to support the Treat and Reduce Obesity Act. This was presented multiple times over the past 10 years, I believe. The last time was in 2021, and it keeps sitting stagnant. And this bill would require Medicare to reverse 20-year-olds stupid legislation that said that the government wouldn't support medications for obesities. There appears to be a lot of support for it, bipartisan, and people understand that it is an important issue, but we really need the public to speak up. And we also need people to advocate for appropriate drug pricing. The voice of the people is really important, and there's no better platform than TikTok. So check out the link to support the bill down below and be vocal. Be vocal, and don't just be vocal here, be vocal to your representatives. And I really hope that we can get universal coverage for these life-saving medications.